Hello and welcome to Coffee with the Commission. Today we will be discussing physician assistant practice in Washington. Joining us today we have PA Commissioners James Anderson and Teresa Schimmels. Our panelists are going to provide a brief introduction and then we'll use the rest of our time to answer your questions. We also have other commissioners and various staff members on the line to help answer your questions. Please raise your hand using the raise hand function if you have a question and I will unmute you. You can also write your questions in the chat box and I'll ask them for you if that option is better suited for you. And just so everyone understands, we cannot discuss specific licensing applications, open cases, and ongoing investigations in this forum. So with that said, Mr. Anderson, would you like to kick us off?
You betcha. Hello, everybody, and I'm glad to be here and have the chance to talk about PA issues, which are certainly near and dear to my heart as one of the two PAs on the Washington Medical Commission. I've been on the Medical Commission for 7 years, heading into my 8th year. The terms on the commission are 4 years, and usually people stay 1 or 2 terms. I'm about 7 years into the total of 8, and it's been a really exciting journey being on the commission. I have been a PA since 2000. I went to medics at the University of Washington and School of Medicine, and my practice has primarily been in pain and in addiction. My first job out of PA school was working in an opiate treatment program, which is where I am sitting right now, Evergreen Treatment Services in Seattle. And I've went away and did some other jobs as a PA, but most of my time has been at Evergreen Treatment Services and in addiction medicine, which is mostly methadone and Suboxone. So that's also a very exciting field too. It's always been an exciting time to be a PA. The PAs have I think a rich and sort of illustrious history, and one of the nice things about the Washington Medical Commission is how there are PAs and MDs who are collaborating closely together. The commission is well served by an amazing staff, and it's been a really positive experience to be able to work side by side with physicians as PAs and MDs oversee the practice and respond to the public's complaints and concerns about the practice of PAs and MDs. So glad to be here. I'm looking forward to hearing any comments or questions you have as we go.
Ms. Schimmels, would you like to provide a little bit of an introduction?
I'd be happy to. Thank you. Hopefully everybody can hear me. My name is Teresa Schimmels. I'm a physician assistant in Spokane, Washington. I am a 1999 graduate from the Spokane satellite of the Medics Northwest program. I worked for family practice for the first almost 5 years of my PA career, and then I worked in dermatology since that time. So I've been, 17, 18, almost 19 years in dermatology now. And the last almost four, have been at the Spokane Veterans Administration Hospital, Man Grand staff, working in the dermatology clinic there. I also teach for the PA program. I'm very active in veterans affairs issues within the Spokane area. I really love working for veterans. I'm a veteran myself, and I'm hoping that there's a student on that is currently at the VA with one of our other PAs, and hopefully he got the message. He can see a little bit about what it's going to be like to practice once he graduates this next year. So welcome everyone. I'm glad to see you. Jim and I have known each other practically since he graduated, and have been friends. And I will tell you, the Washington Medical Commission is an incredible place for PA voices to be heard. They're very supportive of physician assistants and physician assistant practice in the state of Washington. We're very lucky to have PAs on the commission board, and to be able to have input. As we talk about often, if you're a physician assistant and you're not at the table, then you're not being heard. So it's really important to do that at your institution, your practice, or wherever you're at.
Thank you. So again, everyone, if you want to ask a question, you can raise your hand. I will unmute you, or you can use the question box and I'll read those questions for you. But kind of while we're waiting for questions to come in, we get a lot of, we have some frequently asked questions, and I thought we might start off with some of those. So one of the questions we get a lot is, what should you do if you want to quit working for a physician? And Ms. Shittles, Mr. Anderson can help answer this question, but the general process for this is physician assistants or their supervising physician need to submit a letter notifying us that that working relationship has been terminated. And you can email that to us and we just put it onto your file with your delegation agreement. But until we've received that notice, the delegation agreement remains in effect. So just remember, if you ever stop working with a physician, to just let us know so that we can note that in your file. Is there anything else I should add to that?
Well, it's going to change, and I'm sure, Jim, you'd like to talk about that as head of the current PA rules with the new PA law. But currently, yes, it's super important to let us know where you're at and what you're doing and with who. We oftentimes have a lot of confusion about who your sponsoring or supervising physician is. And so make sure you do let us know when those practice plans go away. Jim, do you want to talk a little bit more about the upcoming
Yeah,
rules?
although yeah, sure. And also I would add that in my 20 years I've come across, I mean, I may have had this notion at some point too about how essential it is or it is not to have a excuse me, to have a practice plan always in effect, and to keep the commission apprised about who our supervising physician is. And some of that's going to be changing on July 1st. I think some exciting new sort of modernization rules and have come forward from the legislature. It's called House Bill 2378, and hopefully you'll hear a lot more about that. And Jimmy will tell us a little bit more later about upcoming dates we have for some webinars about this, because there are some really significant and I think very exciting changes. And just to go back to the current rules, which are in effect, solidly in effect until July 1st, is that I think I've come across many PAs who sometimes have thought, well, I mean, is it that important that I complete all this paperwork? And I mean, what if I don't? What if my supervising physician agreement is not current? I mean, how key is that? And the answer, it is really very much key. It's really essential that you have a active supervising physician plan, and that it be current, and that it be on file and approved at this point by the Washington Medical Commission. So I just encourage people to not let that fall through the cracks. I know you're busy, and if you're changing jobs, and oh gee, I forgot to file my supervising physician plan. Well, maybe I'll get to it next week. I mean, it's easy to do that, but I think I would encourage all PAs to really make the maintenance of the practice plan very high on your agenda, because it's really important.
And I'm going to add to that too, Jim, maintenance of just your license, making sure that your license fees are paid in a timely manner, that you're, keeping track of your CME in a separate file, so that if you get audited by NCCPA, for instance, we do not audit your CME at the state. We take it for granted that you are telling us the truth when you say you have your 100 CME hours when you renew your license. So, but make sure you're renewing in a timely manner. You can do it online now. It's super easy. That's how I did it this year. And it was so simple, just to go log on, get yourself into the website. And I mean, I was done in probably less than 5 minutes. So those kinds of things can be really, really helpful. The responsibility for your license is you. No one else is going to take care of it. You may have an office manager or some type of a clerk or another service person at your office that does a lot of that, but it's really vital that you take that responsibility yourself.
Well
I'll
said.
chime in a little bit. Oh,
Sure.
didn't want to interrupt, Jim.
No, that's okay. Please go ahead.
Well, I just wanted to add, what Jimmy said at the beginning was really important, because with the changes, actually, it's going to be even more of the onus on you as a practitioner to make sure that those documents are correct and submitted. We're not going to be approving them anymore, but if there's a problem with them, that's going to be the PA and the physician's responsibility to make sure they contain everything that they're supposed to have in them and make sure that they're filed. So it is really important, to let us know, whether you're still working. If you terminate employment and you're not working with a physician anymore, to make sure that you let us know, and then get a new one on file before you start practicing in a different place.
If I could just add something to those valuable observations, that when I was in PA school, 98 to 2000, it's all big in PA school, as an EPA knows. It's kind of a blur. It's just so much information all happening so quickly, tons of pressure. And I think that the curriculum for PA schools, like even medical schools, is true as well, is very compact, very tight, and oftentimes it's very hard to shoehorn anything else into the curriculum, even though it's important. And I think as a result, sometimes when PAs come out of PA school, and I've heard this is also true perhaps for physicians as well, sometimes we really know precious little about the regulatory function of the Washington Medical Commission in this state, how it works, what are some simple things that we can all do to keep us in good standing. I really don't. Maybe I was sick that day in PA school, but I really don't recall that we had much about that. I think we had somebody from the commission talk for an hour to us once about it, but I think it's such a big deal, and I think when PAs or MDs come out of graduate and go into practice, it's really important that we're knowledgeable about the commission, how it functions, how we interact with it, and so I'm hoping that's changing over the years, but it's really hard to get anything new into PA or MD school curriculum, and so that may be one of the downsides of that.
We also have Dr. Curry joining us. She's an MD member of the commission. Welcome, Dr. Curry.
Hi, good morning, everybody. Sorry, I was a little late. Jumped out of the operating room, but I just want to echo what you said, Jim, because I recently started working with a PA about a year ago, and both of us looked at each other and said, what do we do? I mean, I'm on the commission and I didn't know what to do, and I had never been taught. And so she looked at me assuming I would know what to do. I looked at her also assuming she might know what to do, that she'd been taught. So it's a highly neglected area of all of our education, which I'm on the faculty at a residency, and I try to teach my residents now about this stuff, but it's not well taught, I think. So it behooves everybody to try to learn a little bit, go to the resources on the website. I'm on the commission, your various associations, we have some resources, but yeah, it's across the board, a weakness.
Jimmy, who would they contact at the commission if they had specific questions? Other than Jim and I mean, we're always open to having you email us or ask us questions, as PA members. But who at the commission would they specifically reach out to? What's that phone number or that email?
So you would reach out to our licensing department, and I'll go ahead and put that email in the chat, but it's medical.licensing@wmc.wa.gov, and I'll put that in the chat in case anyone needs to reference it later.
Great. Our staff is really good at helping you out. They're very knowledgeable.
And we do have a hand up, and I apologize if I'm going to mispronounce your name, but Aki Van Beek, I am going to unmute you. Just give me 1 second. Okay, you're unmuted, so if you have a question, please speak up.
Yeah, my question is related to the new rules. If I'm understanding correctly, the way it used to be, anything that I did, my supervising physician had to have at least equal, mastery or knowledge of. But in the new rules, they just have to believe and agree that I have competency in whatever it is, even if they don't have the skill themselves. Am I understanding that correctly?
I don't.
Um,
I don't know the answer to that. I think there's a lot still to be learned as we. I mean, we have the new general guidelines, which starting July 1st, and there's still lots of gaps to be filled in as we go. But Rochelle, do you have a response to that?
Yeah, my name is Rochelle Little, and I'm a staff attorney for the commission. And that requirement has not changed. The scope, and that's still in the new statute that requires that the practice agreement is now called instead of a delegation agreement, and it does require that the PA's scope of practice cannot exceed that of the physician that's supervising you. And so if you do have, you can have more than one supervising physician. If one physician doesn't have, the broadness of practice that you have, you might need to have multiple physicians to make sure that you're covered there. But that requirement isn't changing with the new rules.
Aki, I would add one thing about that. When a few years back, when PAs were able to get the X waiver to allow PAs, and NPs can also get to, it's been around for a few years, as you may know. So PAs can get an X waiver, which allows them to prescribe buprenorphine for addiction. And when that first happened, there was different states were sort of interpreting it differently as far as what that meant as far as how PAs would practice. And for example, some states have said that for a PA to use the X waiver and prescribe Suboxone, that the supervising physician also has to have the X waiver. And really, that's not the AAPA and some other organizations, including the commission, looked at that and felt that really wasn't what the legislation said, which created the X waiver and PAs being able to prescribe Suboxone. And so the Washington Medical Commission issued a clarification statement, which said basically that a PA who has an X waiver and is prescribing Suboxone, the supervising physician does not have to have an X waiver also, but they do have to be eligible to get an X waiver if they wanted to get one. So, but they do not have to have the X waiver. And so I think that was a good clarification, and so it allows PAs to practice even if their supervising physician does not have an X waiver, as long as they are eligible to get one. And it's not hard to be eligible to get one. So that's one exception, one slight exception, I think, or one twist to the question you asked.
Yeah, and that is specifically covered in a written, I believe it's a guidance document on our website. And that, as long as that physician does have the qualifications and training in addiction medicine, then that's allowed.
And just for general information, we are having a rules workshop today at 2 p.m. I'm kind of talking about these new rules and the new practice rules. I've put the link to register if you'd like to attend into the chat, but we'll be going into a little bit more in depth of these new rules this afternoon if you're interested.
Would it be helpful, do you think, to just briefly describe sort of the 6 key changes that the House Bill 2378 is bringing to PA rules? Would it be helpful to just take a moment to describe those?
Yeah, I was just going to recommend that.
Yeah, sure. So House Bill 2378, these are like sort of the 6 key items, the 5 key items that that they change, it removes the requirement that practice agreements be approved by the medical commission. So as Rochelle said earlier, the commission no longer approves or disapproves of a practice agreement. That's although the practice agreement, the commission will still need to get a copy of the practice agreement that's been completed at the site of practice, but the commission no longer will be approving or disapproving of the practice agreement. That's a big change. Also, it removes the requirement for the commission approval of someone employing or working with the PA. It removes requirement for the commission approval of PAs to practice in remote sites. This is a big change. It changes the PA physician ratio from 1 to 5, where in the past it's been one physician can have up to 5 PAs and they can supervise up to 5 PAs, and that's changing it to one physician being able to supervise up to 10 PAs, and with the option to request a higher rate if that's appropriate. And another nice streamlining feature is it removes all the licensing and regulation of PAs under the state's allopathic board. You know, as you probably know now, there's currently there's the Washington Medical Commission, which oversees the practice of PAs and MDs, and there's the state allopathic the state osteopathic board, which oversees PAs who are specifically licensed as osteopathic PAs. So they'll all be under one organization. They will both osteopathic and allopathic PAs will now be under the umbrella of the Washington Medical Commission, which I think will be a nice streamlining change as well. It just seems to make sense.
You can just speak up, Dr. Curry. It's informal.
I have a comment, which is just that previously when you sort of Google PA practice agreements for Washington State, so like literally that's what I did when I started with my new PA to try to figure out what we needed to put, what form we needed to put in. And there was something on the web and we used that to fill out and like file with the commission. Will there be an updated one with the new rule? Because the old one does say like no more than 5 PAs and for any one physician. It's that, you see what I'm saying? So is the commission going to do that, Jimmy?
Yeah, so kind of the plan, and I think we're going to talk about this a little bit more this afternoon, just kind of what exactly, maybe hammer out some of those details. But in the law, in the bill, we do need to provide a template for providers and PAs. So that's what we'll be doing. We have an online form right now, and that is automatically approved if you use that. And we'll reach out to you if there are any issues or we need clarification on it. But moving forward, we're kind of discussing options for, is that form working well for everyone? We are looking for that feedback from PAs and from just healthcare providers, because we want to make a template that really works best for your needs. So we are soliciting some feedback to see what we can do to improve that, but we will be providing a template or an online form that you can use. You can, add what you need to, but it'll just have the general, this is what we need to know as part of a delegation agreement. And then you can either email it to us. We prefer email, save some trees. So yeah, but we will be providing a template, and the details of that are still a little unclear, but we will be providing some resources for everyone. And Michael has a question. I'm going to unmute you. Sorry, it's taking a second. I don't know if anyone can still hear me, but
We can hear you.
Okay, hold on.
We gotta love technology. And when you see all of us raising our hands, we've been doing commission meetings via webinars or Zooms or all kinds of stuff, GoToMeeting for the last year. And so we're used to having between 11 or 12 to 26 or 8 people. And so we raise our hands so that people can see that we have a question. Otherwise, we're talking all over each other and nobody can hear anything. And so that's why we do that. I know everybody else is probably getting kind of used to that as well. Jimmy, you're frozen. You look good though. Well, while Jimmy's unfreezing herself, we've had some really interesting conversations regarding the PA rules hearings, and the support that we've had has been wonderful. We've got one, I think Jimmy put it in the chat. I believe it's this, is it this afternoon, Jim? I think it is, the hearing.
It is this afternoon, 2 o'clock.
So if you have time at 2 o'clock, they don't usually last more than maybe an hour. We're not hashing over too many details right now. We're just wanting input. Most of what's been needed for details have already been done. So join us for that. And then Dr. Curry, tell us a little bit about how you as a physician interact with your PA.
So I am lucky to work with an amazing PA. She was brand new out of PA school, so this is her first job. And there are 2 physicians in my office, so we jointly sort of supervise, so to speak, or collaborate with her. We very much invested in her education. So I'm an OBGYN. So we spent the first few months trying to get her kind of oriented to clinical work and also getting her a little bit more specialized education in our field, recommending resources and working with her to go to conferences and things like that, just to kind of ground her in our field so she had that background. And then we made it a point of having her send all of her notes to us electronically, through our EMR, and we would review her notes and give her feedback. And sort of over the last year, we have sort of decreased the number of notes that she sends to us. We've discussed, what types of patients she can just manage on her own. She doesn't need to check with us. We've instituted a few little kind of guardrails, so to speak, where if she sees a patient with a new complaint and sees them and ends up not kind of solving the problem, by the second or third visit, definitely the third visit, we want her to check in with us to make sure that things are going okay and that the treatment plan is moving along, and make sure, she didn't miss something or whatever. We have her take a lot of photos. So we have the capacity to take photos of lesions and things. So she will use the media available on our EMR so that we can then go back and look at the photo when she describes something. We can decide, was this the accurate diagnosis based on how it looked? I'm sure, Teresa, you can appreciate that. And yeah, we just check in with her at least weekly, but usually quite a bit more because our offices are all in the same area. And just make sure that if there's any, did you have any patients you had worries about or questions about, or was there anything weird you saw today? And kind of just give her a lot of space, but also give her a lot of support and make it absolutely open door policy. She can come to us with any questions anytime. Have us grab us to come quickly look at a patient if there's time, if she has a question. So really make it a low bar, like there's no pressure for her to feel like she has to worry about asking a question. I think that's key to a successful practice. And it's a little different when you have someone who's new. I think if I worked with somebody who is very experienced, and there are PAs that I interact with in my hospital that are very experienced, I treat them like pendings. I mean, I go to them first. Yeah. And so it just depends on where people are at.
Well, and that's, that brings up something that somebody asked about the new PA rules is if we're going to add, specialties and you could do all these other things, should PAs have special training in those areas? And really, I think that's part of your relationship with your physician is getting to know what your physician wants for their practice, but attending CMEs and doing educational and events, and going to shadowing within your own practice is super important. Residencies are great for that because it's all about teaching anyway. Oh, excuse me, Tippy, my dog has found a squirrel outside. But really, it's super important. That's the nice thing about PAs is that we are generalists first. And even for me in dermatology, I went to a CME to learn some skills. I read. My doc I did some shadowing for a month with my doctor before I actually started practicing with him. You know, it's that relationship with your physician is just a great tool, and you really should rely on that. And make sure you feed that. Jim, what do you think?
No, I've been I've been blessed to work with some amazing supervising physicians who really have functioned much the way that Dr. Curry described. I think that's just a really great model. And I also think sometimes, as a slight aside, that working with a new grad can really, particularly in a specialty, the physician really has a chance to help shape them, and that's, I think, a pretty cool thing too. But my supervising physicians, not all of them, I've had a couple whose idea of having a good PA to work with was a PA who never asked them any questions or never bothered them with consultation. I mean, first of all, I think that's a very dangerous model. I mean, we should all be, whether we're PAs or MDs together or whatever, we should all be speaking to each other all the time. But particularly if we take on responsibility of being either being supervised or either supervising. I mean, my idea of a great supervising physician is somebody who's always available, just like Dr. Curry noted, who I can talk to at any time about anything. They never act annoyed if you call them, too many times. They're like, "Thank you, please call me," and so we can consult. But who also treats the PA with respect, and doesn't micromanage where it's not needed. So it's a fine balance between too much too little. But where I work, we meet weekly. There's the physician takes the time to review our notes sometimes in an unstructured way. And if they have concerns, they talk to us, and I have constant access to them. So I think that's a really great model, Dr. Curry. I wish we could clone you and into other so all supervising physicians could be doing what you do, because I think that sounds perfect. And I would say also that there have been times, I mean, not to mention these specific actions the commission has taken, but there are times when somebody might complain about a PA, something the PA did, prescribing whatever, and the review shows that the physician really has no inkling about what's going on, or maybe the physician doesn't even have that skill that the PA is doing, but there's clearly no communication. There's just kind of, yeah, you're on your own. I trust you. You do a great job. And I think that can be, first of all, that can pose danger for the PA and the MD in a regulatory aspect, but more importantly, I think it can be, I think, lead to very unsafe practice. So, a word to the wise.
Sorry about my technical difficulties, everyone. I'm going to keep my camera off just to help with my bandwidth issue, but thanks for your patience.
Hey, we're glad you're still there. We were worried about you for a second. We thought maybe your dog attacked your computer.
He would like to. Michael, did you still have a question that you wanted to share?
Yes, I do. Hello, everybody. Mike Urakawa, physician assistant.
Hi, Mike.
I know some of you. I've got a couple of questions. One question is, in reviewing the law coming into place in July, Jim, you mentioned 6 changes, but you only listed 5. I want to know what the special change was. That's not on the sheet.
Well, actually, I miscounted the dots
Okay.
when I said 6.
Okay.
And in fact, there are only 5. So sorry.
I can accept that. My big question is, when the commission relinquishes the approval process, I think we have a lot of people who are going to find easy access to the practice agreements. Is there a timeline for when the commission will respond if there is an issue related to scope of practice, particularly with ophthalmology, podiatry, optical surgery, those kinds of things, which are not in the current PA laws as far as practice? Is there going to be a feedback or hopefully a good response time to review and say, oh, there's a problem here, or is it going to take quite a while?
Mike, I'm not sure I fully understand your question. So you're saying that, okay, now when a practice plan is completed between the PA and the physician, that it no longer needs to be evaluated or approved or disapproved by the commission. But a copy just needs to be sent to the commission. I mean, my understanding is the commission is not going to be reviewing that or approving it or disapproving it, but they're going to have it on site. And I think should an issue come up with the practice of the PA or the MD or questioning their, how they function, I think at that point it would be looked at. But I don't believe the commission is going to be scrutinizing submitted practice plans. That I think they're just going to receive them and have a copy of it on file. Does that square with what you understand?
Well, I understand what you're saying, Jim. My concern is we have a lot of new physicians that will take advantage of this process, and you have a new PA comes out of school and he says, oh, I want you to do blue light lasers. I want you to do, podiatry, and you're starting tomorrow, and a month from now, somebody says, oh, that's not within the scope of PA practices, so you lost your job.
So I can speak a little bit about the we do have laser rules, and so if your physician does lasers or you're in a practice where there's lasers being done, the physician assistant can do the lasers. As far as podiatry, we just had this come up just recently, and in fact, podiatry, you cannot have a podiatrist for your supervising physician, but if your physician is an orthopedist that does do some podiatry in their practice, then yes, you can do podiatry. I work with a physician assistant currently who works for the orthopedist and works in overlap with some of the podiatrists. She's not, her supervising physician is the orthopedist, and the orthopedist does do some footwork, so it's covered in there. Another one that came up was anesthesia and an anesthesia physician assistant. Same thing, you would get your training, you would follow the anesthesiologist and whatever those rules would be for the anesthesia folks. So I know there are ophthalmologic physician assistants, but I don't know if we have any practicing in Washington State as of this time.
Okay, well, my concern was young physician assistant out of school, young MD who sees easy access to the practice agreements, and to start the process, is there a mechanism to monitor the practice versus the regulation?
Oh, I see what you're saying. I'm kind of understanding you a little bit more. So who's going to monitor to make sure that that's done correctly, so that well, I mean, it's really self-monitoring. It's trust that the physician and the physician assistant are doing the right things. And we're here to help guide that. If there are questions, we want them to reach out to the commission so that we can help them to make those decisions or to help fill out the paperwork if need be, especially with a new grad. And I know that Medix has gotten a little bit more into adding what Jim and I maybe didn't get as far as licensing and things like that go. But really, as we're precepting physician assistants, I try and go over that with them as well. And I think it's responsibility for us senior members of the physician assistant group and for physicians that have had or maybe are in the group to help to guide that.
And I think also the commission takes seriously its role in providing guidance to the population of physicians and PAs who fall under the Washington Medical Commission. I know that there are efforts underway now as far as trying to figure out how do we reach out and effectively reach into those communities and help answer their questions about issues like this. And I completely agree with Teresa about really, I think we're also counting on the honesty and also the ethics of PAs and MDs as we wade into this new change, because the way it is right now too, Mike, I mean, somebody can fill out the form for a PA MD supervising physician plan, and I mean, it would be possible for someone who is less than ethical or less than professional to completely practice in a different fashion than what they turn into the commission. And one of the things about the commission is that we don't have investigators wandering around, in the medical PA community looking for violations. I mean, that's not how we work. We're driven by feedback or questions, concerns, complaints from the community, which prompts investigations. And sometimes we find that people are not doing what they said they were going to be doing with their practice plans, and that can pose problems.
Yeah, that's absolutely right what our PAs are saying. As a staff attorney, many aspects of practice are not sort of actively regulated. We do discipline on a complaint based, and our investigations are on a complaint based system. And so this was the practice agreements previously were reviewed by the commission, and that's no longer going to be happening. And so that whether the scope of the practice agreement is appropriate is now going to fall into the responsibility of the practitioners, and then fall under that complaint-based system for regulation, so that we will not be looking into it unless someone brings a problem to our attention by reporting it.
Thank you very much. Good answers.
Question, Mike, are you a PA or an MD or a regular healthcare consumer?
I'm a PA.
Great. Well, thanks for your practice. We really appreciate it. This is part of the moving towards the optimal team practice guidelines that the AAP has sent out. Washington State's always had pretty darn good practice guidelines for our physician assistants, and we're hoping to continue that trend to improving. I would encourage you to become active and, hey, apply for the commission.
Yeah, and just to underscore what everybody just said, and thanks a lot, Mike, for your questions. It's up to the PAs. I mean, a PA needs to leave PA school with some understanding about how PA MD agreements work and are supposed to work. And if they don't, then they can be setting themselves up for difficulties down the road.
Now, Teresa, back to your comment real quickly. I know this is off topic, but does the commission have PAs as pro tem members?
They do have PAs as pro tem members. I was actually one very soon after I graduated, because we were reviewing the PA rules and trying to update them back in 2000 or 2001, and I graduated in 99. And then I am going to be off of the commission. This is the last of my second term. They're 2 4-year terms, and they have asked me, they've hinted at me becoming a pro tem. So yes, I will become probably a pro tem for the remaining amount of time that I'm allowed to have that, so that I can continue with some of the cases I have, but also continue to give input. It's important to have that experience, and kind of that long-term institutional memory is really important too. And we've made a lot of changes over 8 years.
Mm-hmm. Yeah, because I'm a pro tem member of the osteopathic board.
Oh, you are? Oh, wonderful.
But that's going to end in July, so.
Yes, it is. Yeah.
So you're looking for a pro tem gig.
Yeah. You know what? I would reach out to the website, the licensing website that Jimmy posted, or just to the commission, and talk with them about it. You know, we certainly could use your help.
And Mike, I know Mike, and Mike, I'll sniff around a little too and see if I can find more information about that. I mean, it's possible that the commission could benefit from utilizing more PA pro temps, but I'll poke around and let you know what I find out.
Okay, and also, how do I print the comments that were posted by Jimmy?
I think
you might have to copy and paste. Yeah.
I don't know that you can print the comments, but I have your email from your registration, and I can just email you those resources if you'd like.
Thank you very much.
Okay. Aki had to sign off, but she did have a question before she left, and so maybe we can answer it, and she can view the recording for the answer. But she asked, and I'm a lay person, so I apologize for the mispronunciations, but does craniosacral therapy fall under a general license to touch or as a separate skill that requires a supervising physician?
I know what craniosacral therapy is because I worked in physical therapy for a while, and there were some people who were affiliated with our practice who did craniosacral therapy. But I don't know the answer to that. As far I don't frankly even know about if there's licensing for craniosacral therapy specifically.
I think if it's in the context of osteopathic manipulative treatment, so OMT, is that what, I don't know if that's what she was referring to, but if it's a OMT procedure, osteopathic manipulative, then if you have a DO supervising physician, then the physician assistant should be able to perform that in the context of the normal DO sort of armamentarium of treatment options. It is OMT is not something that MDs can supervise, so it does have to be a DO physician.
You know, craniosacral therapy is it's based on extremely light. I'm not sure if it's that or not. It's based on extremely light touch. Like sometimes in people who teach craniosacral therapy, they teach the practitioner who are usually, it seems to me, physical therapists, and it ends up being sort of a branch of physical therapy has been my perception. But they teach things like the touch should be no heavier than the weight of a fly or something like that. So I mean, so it's very very gentle, and I know I don't know if it falls under the osteopathic purview or not, but I'm certainly gonna check that out because I'm curious now about it.
And I'll make sure she gets that answer, and if there's any other follow-up, I'll reach out to everyone and see if we can't clear up that question. If anyone else has any other questions, please feel free to raise your hand or type them in the box. But we're kind of coming toward the end of our time. So while maybe some questions are coming in, is there any other parting thoughts you would like to share?
I would say that it's really the new regulations rules from House Bill 2378 I think are really exciting, and I know that, and I think they're in the end they're going to improve practice. They're going to allow PAs to function at their full abilities or full scope. They're going to maybe take some of the cumbersomeness, if that's a word, out of the whole process for both physicians and PAs, and I ideally do so in a way that's not going to sacrifice the safety of the public. So I think these are really great ideas, really common sense, and I know the commission is going to do everything we can to make them work well for MDs and PAs, but more importantly for the public.
Yeah, and I would second what Jim says too. These new rules are going to be really wonderful. This is what I know I have worked towards over the past 21, 22 years of my PA career working with first the medical commission, with WAPA, with AAPA, back with WAPA, and now with the medical commission again. We want to make sure we're optimizing this, that we're really building on the trust relationship and the team relationship that PAs and MDs have. And the commission is here for you. If you've got questions about stuff, you know, contact us, contact Jim and I separately, or contact the commission. Rochelle and the legal team has great information. Our docs have really good input and great experiences. And thanks for letting me be on the panel today, Jimmy. I appreciate it.
Well, I just want to thank everyone for attending and participating. I think we had a really great conversation today. And this recording will be available on our website within the next few days, and we encourage you to share it with your circles. And like Ms. Schimmel said, reach out to us with any questions. Everyone should have my email from registration, so if you would just like to email me, I can find the appropriate party and get you the answers that you need. And as a reminder, we have a PA rulemaking workshop today at 2. And please mark your calendars for May 5th, when we'll be holding a webinar on common laws, rules, and regulations that all PAs and their MDs need to know. And then on June 16th, we'll be holding another webinar regarding the changes coming to PA practice as a result of the recent rulemaking and legislation. I've put that link to our event calendar in the chat, and I hope everyone will be able to join us. And on behalf of all of us at the WMC, thank you so much and take care.